introduce myself. Just so you guys know, raising the bed, a lot of people thought raising the bed was a part of the CPE. It's not. However, it is to protect your back, understandably, because there's a lot of people that have herniated their backs and are no longer nurses because of that. So that's what that was for. Everybody was like, do I have to raise the bed? Am I going to get it wrong? No. Like, y'all are okay. So when we do Foley catheter insertion, someone tell me what are my first steps. Okay, tell them what I'm doing. So, yeah, that's fine. So, Miss Kelly, I am coming in today because I'm going to be putting in a Foley catheter. That's something that goes into your bladder and takes the urine out of your bladder. We're putting that in today because you have a urinary tract infection and we want to prevent further infection, okay? All right, you may feel a little discomfort during this procedure, but I promise it'll be over quickly. Great. So, now, we are using repackaged kits. When you get to your CPE, you all have fresh kits that you will be using, so please do not worry about that. This is just for the sake of lab, because there are how many of you to how many of these, okay? So, these are not going to be on there. This is from our other class. So this is a male. All right, so a lot of people make their sterile field on their bed, and I am fine with that. The biggest thing is making sure that we open everything correctly and that you are maintaining sterility during this process, okay? Please be easy with these. So I'm looking at my bag. The first thing I see here is this is a 5 ml silicone Foley catheter kit. So I'm gonna go ahead and open. Why am I hearing an Oh. So this one is also, I do ask that when you guys repackage these, please make sure you repackage them well so that stuff like this does not happen. You want the next person that's going to be using your kit to be able to use it to the best of their ability, right? So sanitize. Put my gloves on. So what am I gonna do first? Peri-care.
Oh.
Peri-care happens first, right? We wanna make sure it's clean. How do I do peri-care on a male? Someone tell me.
From the head down the shaft.
Okay. And what's the premise with clean and dirty and wounds?
Least dirty to most dirty?
Nope, other way around.
Most
Dirtiest to cleanest. Because why? We don't want to push all that dirty stuff into something that's already clean. So when you're doing peri-care, it starts from the in and goes out and around or away. You may use these on your mannequins. It says on some of them not to use them. Please ignore that. We have way too many of these. Really, like a whole stockroom full. So please use them. All right, now I've done peri-care, so now I'm gonna start the rest of my process. You are required to use the fenestrated drape or the balloon that is in your kit, so please be mindful of that. This is considered a sterile field, so I should not be leaning. I should not be letting my hair do any of that. I shouldn't be letting my badge get in the way. You also will notice that I am just handling the corners. Why is that the case?
You have a 1-inch border for sterile.
Very good. You have that 1-inch border for sterility. You'll see it in your sterile gloves. You'll see it wherever, okay? This is an extra fenestrated drape, so I'm just gonna slide this off to the side here. I don't mind using these because I've grown using these all the time. So I'll go ahead and use these. These are my swabs that are also for peri-care that you are required to use, okay? And then I go ahead and just set this off to the side. Now, everything in here is sterile, right? Okay, so now I'm gonna go ahead and put my sterile gloves on. Now, correct me if I am wrong. In the video, does she do the iodine care with her sterile gloves on? Someone should have watched. Yes? Okay, very good. Why do we think that's the case? Why can I take that out but then not without sterile gloves on?
everything in there is sterile.
Very good. It's inside the packaging, right? So I'm not going to touch the outside of the packaging, and you always have a non-dominant hand. These are sandwich gloves. Yes. These are definitely not sterile gloves. Ooh,
Oh.
okay. We're kidding about that. It's a good thing I brought an extra pair. So, oh, these are 6.5. All right. So, first things first is we are going to put our sterile gloves on again. We have that nice, pretty little 1-inch border. This is something I want you guys to learn on your own accord. Okay. So, a lot of people, what they do, and if I break sterile field, it's because I want to show you something. What a lot of people end up doing is flopping the fingers of it, and the fingers end up touching something. While you're trying to do this, the fingers are dangling. So my best way I can show you that is, okay, I'm starting to do this, and you're trying to do this, and all of a sudden you've done that. Okay. These are just barely fit. Okay. Oh, they smell awful. It's miserable.
Some hair in there.
Sorry, guys.
So even after you open, your gloves cannot touch, even though that's sterile on the
Your
inside?
gloves can touch this. I was more so using that as an example.
Of just
a lot of
something
people
else.
will either have it touch their person or like the table itself.
Right, okay.
Oh, Lord. Y'all.
Oh, you ripped it.
That's okay. So, if that happens during your CPE, what would you say? You would say, I would go get a new pair. We are not going to make you go get a new pair and re-glove. It's okay. We would understand. But you still would act like that's not there. Okay? So, now we get to the point to where I go ahead and I'm going to do peri-care again. So a lot of people open it beforehand and drop these in here. That's something I did forget to do, is opening it and drop it in the kit before I go ahead and put these on so that these are not touching, okay? So what way to out?
Clean.
Clean, right, cleanest to dirty, so out. And then I just drop that in there. You also may throw these away because I have way too many of those. Okay, great. Next, before I do anything, I'm gonna go ahead and work and make sure that this gets attached. Beautiful, there's not a lubricant in this, so this is gonna be pretty challenging. So we would put the lubricant on the tray here so that you can lubricate this aspect of it. This is all I need. So this is where people need to be careful, because this is the part that most people break sterility. Once I have done this, am I allowed to move?
No.
Nope. That's it. I have committed to the bit, okay? So we are now, this is gonna be very difficult for me because I don't have any lubricant on this, but normally you would have lubricant on this, okay? You would just put it in your tray and put it on your tube. So how deep for males do I typically go? Okay, so we go in, and when do I keep going?
So you get a flash, right?
Right, so I get a flash of urine. So this is a 5 ml balloon. I'm getting a little resistance, which means I'm not all the way in there yet. If you get resistance, you should not try and force that, because trust me when I say these things will explode in your face. I had a lot of them explode last semester. If you burst a balloon in CPE, that is considered a fail, because that means you're not all the way in the bladder, okay? You should not get resistance with that balloon. Okay, let's see if it went in anymore. Okay. Still getting a little resistance. It's probably because I don't have lubricant.
And the only reason why you're allowing your hands to touch is because you don't have the lubricant. Or else otherwise you wouldn't be doing...
My hands are, at least this part is sterile. So
Okay.
here I would hold like this.
Okay.
And this you can get as close as you want, because this is my sterile hand.
Oh.
Right? Because this is a sterile procedure. I can touch all I want. This is the only hand you wouldn't want, but yes, I'm doing that just so I can like try and manipulate it in there, and I might not be able to without the lubricant. So remember, dominant hand is always your sterile hand. Non-dominant hand is your clean hand, right? Those are our premises. Those are our premises of aseptic technique. So we're gonna pretend like I'm able to get that all the way in there. I would then inflate this all the way to 5 mLs. I actually may have gotten it. Nope. So we're gonna do my best here. So once I've inflated it, I'm gonna pull back just a little bit to make sure that it is secured. Now at this point, do I have to be sterile? No. Right, we're done. So how would I secure it to my leg? Yeah, so we don't use stat locks here. We use the catheter straps, which are over there. So I would just strap that to my leg. Where does it get fixed on to the bed?
The bed itself.
All right, a non-movable part. So I'm not putting it on my side rails, I'm putting it on my little hook that exists solely for that purpose under the bed, okay? Then I secure it nice and pretty like. I name, I date, I put my package away. I say, Miss Kelly, can I get you anything else today? Do you feel okay? Are you in any pain? No? Okay, wonderful, I'm glad to hear that. Here's your call bell. Sorry for exposing you for a little bit. Here's your call bell. Call me if you need anything. Have a fantastic day. I'm done. Okay? That's Foley.